Hi, everyone. This is Joy Rosa with Earthworks Acupuncture. And last week we talked to Kendra Sims, a PhD candidate in epidemiology, about risk and prevalence or existence within research and research models. And we're shifting gears just to kind of hone in on one specific example regarding high blood pressure um, and how that affects the kidneys and various kidney diseases. So welcome back, Kendra.
Yeah, it's great to be back. And I'm kind of excited to talk about my specific research focus, which is hypertension or high blood pressure. And people might not realize that over a third of US adults have hypertension if you use kind of some criteria, and that's over 100 million people. And you definitely know someone in your life who has high blood pressure. It's There's been this large ongoing study of United States adults, and it's called the National Health and Nutrition Examination Study. And it found that a greater proportion of Black and Latino adults in that study than white had high blood pressure. And so again, that's prevalent. So it's existing cases again. And more of those minorities in that study were diagnosed before the age of 65. So, yeah. And one reason that that's a problem is because how people get hypertension, how it develops in a person. So what is it? It's, if you just want to strip it down, it's your heart working harder than it should to just push blood through your vessels. And so over the times, your vessels, they start out nice and flexible and wide. They get, just think of like them getting callous because there's so much friction going down them all the time. And so more blood in a small space, it just means higher pressure. Yeah. And at the same time, just think of your heart, it's a muscle. It's about a fist-sized muscle and it's beating. And what does a muscle do when it's like working really hard? It's getting bigger. So that over time is just like this cycle of like damage. And for years, decades even, you might not even know it's happening.
We segue a little, just a little bit about, right, we're talking about like patterns over time, and I think there might be some inquiry as to why we are seeing higher rates of high blood pressure and cardiovascular disease within these minority populations. Like, what are some of the socioeconomic factors, for instance, or even life or death instances that people are going through that affect this?
Sure. So there's been a lot of research in this area. So at first they tried to explain it with genetics. It was thought maybe that there was this slave ship hypothesis, and it thought that like through like selection of the slaves that survived on slave ships, they were able to like store sufficiently. They thought, okay, maybe it's a genetic thing, and that's why a lot more black people have high blood pressure. And then they've done a lot of the genetics of Black people who have had and don't have blood pressure, and they've found that no, that is not explaining it. There's not differences. They've looked at, the way you treat it. A main way of treating it is taking medication. So they thought, all right, is it that these Black people are taking their medications less often than white people? Again, after you control for that, which means that if you look at Black and white people and look at hypertension, but also see who is it taking their blood pressure, there's not any meaningful differences between those groups. And they've also looked at, the ways that are recommended to prevent and control your blood pressure are exercise. So like a heart that you've like trained with, especially running or like cardiovascular activity, it doesn't have to work as hard. So they thought, oh, are these minority populations just not exercising as much? And really, none of those explanations are really explaining those differences. So in my research, I look at stress because your kidneys sitting on top of those are your adrenal glands, and they are really, they produce a lot of stress hormones. And so also in my research, it seems that if those stress hormones are released the stress hormones are released among Black people or minority people who are reporting more, say, discrimination, which is what I do.
Yes, yes, discrimination, and even death.
Yeah.
Um, Well, thank you for kind of
Oh, yeah.
making that succinct. I think that's very important to hone in on, especially right now in history.
Of course. And it's definitely why I do what I do. Yeah, another way to think about blood pressure is,
How about the numbers, like the top number versus the bottom number? We call
sure,
it systolic versus diastolic.
sure.
Which, how is that related to what people are seeing with blood pressure?
Sure. When you measure your blood pressure, that top number is your systolic blood pressure, and it's the maximum pressure that your heart puts against your blood vessel walls
Mhm.
when your heart is beating. So that's your systolic that's your systolic reading. And your diastolic, that bottom number, is the pressure when between beats. And though both are important, the systolic, that top number, really is just giving you, it's really what predicts who goes on to develop heart disease or um, another disease that it causes is a kidney disease, which I know you and Dr. Lee talked about before.
Definitely.
There's a network of blood vessels that are flowing through your kidneys, and your kidneys, which are doing all this work to really just filter all of the waste in your body and fluids, can really be affected those if all those vessels are weakened and narrowed.
Mhm.
So without enough blood flowing to them, it just makes the kidney, less effective in doing what it's supposed to be doing, and that can lead to kidney damage. High blood pressure, hypertension is also it's like this after diabetes. It's the second leading cause of end-stage kidney disease, which disproportionately affects Black adults compared to all other groups. If you have high blood pressure, that also might be a symptom that you have kidney damage, because one hormone that your kidneys produce to keep your blood pressure stable would be affected. So again, it's a cycle.
Right. And this is cortisol that you're.
It's
Oh,
aldosterone.
yeah. Okay. Yeah. You were clarifying.
Well, of course, one type of the medication that's used to it's because it might be producing too much or it might not be producing enough. So what a common type of antihypertensive medication is supposed to do is kind of regulate that for you.
Okay. I love this discussion too, and how, we've kind of touched on that extensively actually with Dr. Lee. But I just wanted to kind of reiterate how Chinese medicine can be related to and effectively treat hypertension um, and cardiovascular disease, actually. So with Chinese herbal formulas, that's where we're really doing a lot of like the powerful work. Um, as you stated, hypertension is a chronic disease in which like pressure of the arteries are elevated, and so that's why that top number and bottom number are really important to look at, especially the bottom number, because like what your body is doing at rest, if it's like churning too much, that is a problem. But the top number is also very important. Also, there's some, as you were touching upon, like what they call comorbid factors that happen when you have elevated blood pressure. So we can see that affect your heart, your brain, your kidneys, and like any kind of peripheral vascular disease. There are two really important and ancient texts in Chinese medicine, the Huangti Neijing and the Nanjing. And these are part of the classical medical theory. And so there's a proverb in there that states, you treat what is not yet ill. And so that's a really proud and profound tenet in Chinese medicine, because as is similar with epidemiology, we're looking at patterns, and you can actually catch a pattern in an early stage of a pattern and effectively treat what is not yet ill. So if you came in one day to a clinic and say, for instance, I were to take your blood pressure and it was just like slightly elevated, 120 over 80 is what we're seeing as like a normal, but on other scales, most recently, we've heard that that is like the lower end of the beginnings of hypertension. That varies, from gender to age to, general health, what that normal number is for you. But the efficacy of treating hypertension and renal disease and also cardiovascular disease is actually really high. And so I'll stick with hypertension for now. So there's like lots of numerous case studies that have been published from randomized controlled trials, which Kendra, as you mentioned in one of our videos, is like the highest form of testing and research that you can do to prove things are actually effective within treatment. So I'll link the study that I actually pulled some of this information from. But what we really wanted to hone in on, though, was, right, like there are even a lot of meta-analyses on traditional Chinese herbal formulas that have had really wonderful impacts. They show a lower rate in blood pressure variabilities, and they have effects on other symptoms related to high blood pressure. So when we're looking at this, to that quotation of treating what is not yet ill, very similarly with your research in epidemiology, if I see an Indigenous Black person of color in the clinic, and I understand culturally that there is an enormous amount of stress on a regular daily basis, I'm going to take that into consideration in my treatment, right? And so when you see things like high amounts of stress, you're going to see things within a Chinese framework that have to deal mostly with the liver. The liver is the wood element. It's associated with anger. It's associated also with growth. When you are also under enormous amounts of stress, we often see liver patterns like liver fire. And when we think about the fire element, you see like that kind of rising, or liver yang rising. Those are indications of high stress and then how it can physiologically affect your body. So to my point, if I'm seeing, say, you, for instance, coming into the clinic and you've just gotten, other national news, and you're upset about this, and you're also stressed out about this because you're also a runner, say, then I would be treating you and your liver pattern first to see if we can kind of bring back harmony and balance to your microcosm, yourself. And if you are still experiencing high volumes of stress over time, then you're going to see this liver pattern start to affect things like your kidneys and your heart. This is another way of like seeing the pattern treatments. Other patterns that can be involved with this are also like phlegm fluid retention. So this has also a comparative lens with kidney disease, renal disease in Western medicine, because when you're thinking about fluid retention, right, with the kidneys, I mean, that's also similar in Western medicine too. You're seeing, higher volumes of sodium and fluid retention there. And even with dialysis treatments, they're trying to get this extra fluid out of the body because the kidneys can no longer filter properly. So yeah, TCM, this has been, again, over 3,000 years of empirical evidence that has been written and recorded. And it really does show improved clinical symptoms by treating, especially with herbs.
I learn something every time. Yeah, no, there's a lot of a lot of the focus in the Western model is on like the behaviors that people are doing. And when those aren't really answering the questions, we have to I try to zoom out a little bit because, what are these inputs that people are dealing with? Because the stress response is not just like your inputs, but how you cope with them. So, instead of saying like, oh, exercise more is like, all right, can you exercise more? Are you able to get out and exercise more? Do you have the funds and the disposable time and income to, have that prescribed healthy lifestyle? So
exactly.
It's all the big picture.
And that's another thing too, to point here is, in the 30 to 40 years that Chinese medicine has become popularized and available in the United States, we often see this as inaccessible to Black, Indigenous people of color, mostly because of, financial reasons, but also lack of insurance. Um, uh, the distance to travel might be affected by this, and yeah, just basic access to this kind of care. And because this is so effective with even just herbal treatment, you can definitely begin your healing journey with one treatment, with needles or without needles, or a formula, and see a marked improvement. And I think that that is kind of like the key to, right, beginning this hopeful quest. It's kind of how I came into Chinese medicine too. And just to kind of iterate. And people take herbs in Chinese medicine. It may take a time or two to take a formula or refill a formula to even see effects. Typically, you'll see an effect of a formula within, like 1 to 2 doses. But for a longer lasting effect, you're going to be refilling formula, a couple of times, especially if you are in like a later stage of cardiovascular disease or kidney disease or something of that nature. But that doesn't mean that you can't treat it. And that doesn't mean that we can't see marked improvements in your lab results or your test results, or even like your blood pressure reads. So just to say that, herbs might take a little bit more time, but they can be typically more cost effective. And that is also in saying, as long as we have access to this kind of care. So that's also kind of my job on this side of the medical fence to make that possible.
Definitely a more to deal with high blood pressure, which is such a complex problem. You have to come at it from a lot of different angles. Like, do what you can, but I think that empowering knowledge of knowing, like, oh, what is there I can do, what avenues I can take, it might not just be a one hit. It won't be like a one hit thing. It's like a lifetime of change.
Definitely. And that's a great point too, is, Chinese medicine historically has worked in tandem with Western medicine and Western physicians. So this isn't to say, oh, I've got high blood pressure, I can stop taking all my medications and just go to an herbalist. No, we don't recommend that. We are going to work with your care providers and physicians in hand and address things accordingly. Like as professional licensed herbalists, we really do take into consideration the not only drug to drug interactions, but the herb to drug interactions. And we base dosages even in your customized formula off of that. So it's good to have full transparency with all physicians at all times. But Chinese medicine definitely has high effective rates for this, and yeah, people should definitely look into that and see it for them.
Yeah, and that's all I got. So, really appreciate, we got to chat about blood pressure, which is
Thank you, Kendra, so much. Next week, we're hoping to kind of get into some liver diseases, because moving forward, I think it's just ideal to start talking about what has impacted minority, unserved, and underserved communities the most, because even moving through COVID-19 pandemic, we're seeing these healthcare disparities like very blatantly. And so I think it's nice for people at home to at least have an idea of what they can do to kind of bring back agency and peace of mind to themselves moving forward. So
singing to the choir, but yeah, that's great.
Thank you so much, Kendra. We will talk to you next week.
Yes, looking forward to it.
Bye.